my name is Mickey and I'm going to demonstrate to you how to properly use the small volume nebulizer. Before we go on with that, I'm going to go ahead and look at the patient's chart to see what the reason is that they're here for. So I'm going to look at their name, their date of birth, and the reason, some indications on why the patient would be here is because they're experiencing some type of bronchoconstriction or exercise-induced asthma, or some wheezing. And so we're going to go ahead and administer today Duoneb, a medication that's called Duoneb. And what that consists of is it's 2.5 milligrams of albuterol and 0.5 milligrams of ipratropium bromide. So before I go into the room, I'm going to gather my material, okay? And so what I have here is I have a bag first off that I'm going to put, I'll leave with the patient on back of their headrest. That way, in case they need a treatment later on throughout the day, we could just put the used equipment back into their bag, and we're going to put their name. That way they could continue to use the same one, okay? So we have our peak flow, and then we have our breath actuated or continuous mouthpiece here. I'll demonstrate this in a bit, okay? And then we're going to use our O2 saturation, some Kleenex because we're going to need the patient to cough, blood pressure, cough, gloves, of course, our hand sanitizer to wash our hands, and then the rest of the stuff for the material to put for the mouthpiece in regards to how they're going to get their medication. And then, so I'm just going to go ahead and put 3 mLs of hand sanitizer. Now you want to wash your hand if there's a sink. If there's not, then you just grab some 3 mLs of hand sanitizer. You're going to rub for 15 to 20 seconds, or until it's completely dry. Okay, I'm going to grab my gloves. Knock before I go into the patient's room.
Come in.
Hello, Miss Adano. My name is Mickey. I'm a respiratory care student from Hartnell College. I'm going to go ahead and it looks like the doctor has put in an order for some medication for you. I'm going to go ahead and show you how to use that. Is that okay with you?
Mm-hmm.
Okay, first can I start off by asking you what your name and your date of birth is, please?
Diana Ivy Cedeno, 9/21/92.
Okay, perfect. May I check your wristband?
Mm-hmm.
Okay, thank you. So I'm just going to check her wristband to make sure that it correlates with what she said, and it does. Okay, thank you very much.
Mm-hmm.
Okay, so before I continue to give you, before we could continue on, so we could start the medication, I need to take your vital signs. Is that okay with you?
Mm-hmm.
Okay, so what that's going to consist of is I'm going to check your blood pressure, I'm going to take your temperature, I'm going to check your pulse, and listen to your birth sounds.
Okay.
Is that okay with you?
Mm-hmm.
Okay, perfect. I do also need to see if I could get a sample of your cough.
Okay.
Is that something you could do right now?
Mm-hmm.
Yes? Okay, I'm going to provide you with Kleenex. If you could just go ahead and cough into this Kleenex, a strong cough, and you want to just inhale in and then there. Very good. Okay, perfect. Do you feel okay?
Mm-hmm.
Okay, thank you. So I'm just going to look, and it looks nice and clear, so that's good. I want you to go ahead and discard of that. Okay. And so now what I'm going to do is I'm going to take your temperature. Okay. Okay, this is going to go in your mouth here. Okay. Okay. Just there you go.
Now, just one last thing before we begin, okay?
Very good. Okay. Thank you. Okay. Very good. And so it looks like it's 98.7, so we're good with that. Okay.
And then what was your age and height?
Okay, and so now what I'm going to do is I'm going to check your oxygen saturation. If I could have you place your index finger in there. Very good. It's going to make some beeping noise. If you could just relax. And then what I'm going to do is I'm just going to check her pulse right here on her wrist, just to make sure that it correlates with the beeps right here. Okay, and I just want you to relax, please.
And then you're going to blow out like as hard as you can. Like you're going to blow out candles or anything like that, but a really big one burst. Well, you're not, okay. So we're going to do 2 more. We're going to pick the best one. But you reached it. treatment is about 10-15 minutes long. So I'm going to turn it on, and we're going to check to see if mist comes out, and then when it does, you're good to go, okay?
Very good. Thank you very much. Let me go ahead and remove this. So what I did is I checked it for a full minute. Actually what I did is I checked her breath sounds for 30 seconds, and then I multiplied it by 2 since they were normal, and then I did the same thing with her pulse. I checked it for 30 seconds, and then I multiplied that by 2. So right now her breath sounds, I received 13 breaths per minute, and then for her pulse it was at 72 beats per minute.
You want to make sure you check their saturation levels during treatment, see if it goes down or it goes up. And then also,
Okay. And now I'm going to go ahead and obtain your blood pressure, okay?
Shaky, your heart rate increases, but that's normal for medication, so nothing that's bad. But
This is just going to wrap around your arm. I'm sure you're probably used to this already, right? Yes.
Okay. Time passes, and then you come back and you close. So now you can turn off the machine.
I am going to ask if it's okay with you, Diana, if you could just go ahead and hold this for me. Okay, I appreciate that. Thank you.
And I'm gonna check your vital signs again, okay?
Okay, and I just want you to relax, okay? You're going to feel some tightness on your arm. Okay, 118 over 70. Okay, I appreciate it. Excuse me. Thank you. Let me just go ahead and put this down here.
We'll have you.
Do you have any questions for me so far?
No problem.
Okay.
That's freaking real.
Okay, so now what I'm going to do is I'm going to listen to your breath sounds. Is that okay with you? So what that's going to consist of is I'm going to need to listen to your the back of your lungs, or your back side, and then your front side. And then I'm going to start off on both ends. I'm going to start off on the bottom and work my way up. Okay? And if at any time you feel dizzy or lightheaded, please just let me know. We could go ahead and take a little break. Okay? I am going to ask if it's okay. If you could just turn it slightly to your side. Okay? Is that okay? Okay. So when I tell you, if you could just take a deep breath in, okay? Okay, take a deep breath in. Very good. Another one, please. Very good. Another one. Very good. Another one. Very good. Are you doing okay? Another one. Almost there. Go ahead. Okay. Are you feeling dizzy? Okay. Very good. Thank you. Go ahead and roll. Now for this one, since it does consist of me checking the front, is it okay if I snap the gown part a little bit? Okay, thank you. Okay, I'm just going to sneak it in here. Okay, and if you could just go ahead and take a deep breath in. Very good. Go ahead and take a deep breath. Very good. Another one. Okay. Another one. Very good. Almost done. Perfect. Are you feeling good? Okay. Very good. One more. And it's going to be right here. Very good. Thank you. So the reason that I checked her neck was I just wanted to make sure I didn't hear for listen for any stridor. In this case, there was none. Okay. Are you feeling dizzy or anything? No. Okay, very good. Thank you so much. Okay, so prior to starting the medication, I am going to ask to have you perform a peak flow. And what that does is it's going to measure the volume, your tidal volume that you have in your lungs, okay? And I'm going to go ahead and walk you through it as well, but let me just tell you. Based off of, can I get your height, please?
5'4".
Okay, and then your age?
24.
Okay, perfect. So I'm just going to check right here. Okay, so based off of your height and your age, there's a goal. And it looks like your goal is at the 418, okay? And what you're going to do is, you see the little red slider right here? You're going to take a exhale out, and then you're going to breathe in, okay, take a big inhale, seal your lips around the mouthpiece, and then you're going to blow out like if you're blowing out some birthday candles. Okay, now for this, I am going to ask if you could sit up. Is it okay if you could sit up? Okay, do you need help?
No.
You're okay? Okay. You feel okay? Okay, perfect. Do you have any questions so far?
No.
No? Okay, you could just go ahead. And remember, I'm going to walk you through it. So I want you to exhale out. In. And then, blow. Very good. Good job. So, okay, I got 350 for the first one. Okay, so we're going to get the best out of 3. Okay, so we got 350 on this one. I want you to try to put a little bit more emphasis on the second one, if you can, okay? So breathe out, breathe in, and boom! Very good. Good job. Very good. Okay, are you feeling dizzy? No? Okay, very good. So on this one, we got 400, and we just need one more. Okay? And breathe out. And boom! Very good. Good. Wow, good job. Okay, so we've got 400. So we'll take 400 as the best one for right now. Okay. Now I will let you know we're going to be performing this again after your medication, and the reason for that is that we want to make sure that we see a 20% increase, and if there is a 20% increase, then that's an indication that the medication is working.
Okay.
Okay, so let me just write this down. That was 400. Okay, now before I start with the medication, I do want to let you know some contraindications that could be expected maybe with this medication. The medication, it could probably make you a little bit jittery, make your heart rate, heart increase, and that's completely normal, okay? I don't want you to feel as though you're having anxiety or anything like that, okay? Now, we're going to be using a mouthpiece, and the reason that we're going to be using the mouthpiece is because for a face mask, the contraindications on using a face mask is that the aerosol could go into the patient's eyes, or also the long period of that's not contraindication of the small volume nebulizer, is long period time of the medication. Okay. Now, for usually when we have we have 2 separate mouthpieces. One of them it usually has an indication. There's like little indicator where you could change it, and it would have the little dots. If it's the dots, then that means that it's going to be breath actuated. That means that it's going to consist of the patient needing to take a deep breath in order for the medication to be activated and for the patient to receive the medication. The other, you would be able to turn it, and it would have just a triangle, clear triangle, and that would be continuous, and that would mean that it does not require a breath actuation, so therefore the medication will just continue to go on, and the patient will just be receiving the medication. Okay, so let me just go ahead and put everything together. Okay, and before I do, I'm going to grab a medication here, and then I would scan it. And then, Miss Adena, can I see your wristband? I would scan that just to make sure that it matches. Okay. And then I'll just get that. And then pour it in there. Very good. And so this is usually detached. Now we'll just attach him. Okay. Here is the
basically
mouthpiece.
small nebulizer treatment for
Okay.
patients. And the medications are doing that, and albuterol
Go.
and
Correlated tubing.
ipratropium. Albuterol is 2.5 milligrams, and ipratropium bromide is 0.5 milligrams.
You just put this because we
So,
need a gas source.
devices that we're going to be using.
And so, Ms. Adeno, I just want to let you know that you're probably going to be hearing a bit of a noise here. Okay? So let me just turn this on here. And then I would put this at anywhere from 6 to 10 liters. So I'm going to put this here. And it's at 7 liters. Okay, and I just want to make sure that I see the mist. Okay, that means that we're getting the medication. Okay, Miss Adeno? I'm just going to go ahead and have you, I want you to just breathe in regularly, normally through your mouth. You would seal your lips around the mouthpiece, okay, and just breathe in. And after maybe like 5 or 6 breaths, if you could just go ahead and hold your breath in a little bit, and then just exhale out, okay? So I'll just leave you with this. And this medication usually takes about, it could take anywhere from 5 to 15 minutes, okay? And so I will just go ahead and document my vitals and everything. And then I'm also going to place the pulse oximetry on your finger, okay? Excuse me here. And just relax. And I'm going to leave this here because I just want to make sure that there's no increase in heart rate, you know, or anything. Because if there is, then I would need to stop the medication, okay? Do you have any questions?
No.
Okay, perfect. So we would just monitor her pulse and then go step out and document what we've instructed the patient on and everything, okay? So in this case, we'll just say that it's already been the 15 minutes that have passed, okay? So Ms. Adeno, looks like you're done with your medication, okay? Okay, so let me just see here.
But before I continue, can I have your first name, your last name,
Yes.
and date of birth?
Okay. So the reason that I'm just checking is we just want to make sure we want to debit just so the extra. We want to make sure the patient received all of the medication. Okay, so in this case she did. So I'm just going to. Okay, put this right here. Okay, very good. So I'm actually going to recheck your vitals. Okay, so I'll just go ahead and leave that there. Okay. Are you feeling okay? Okay.
And for that, I'm also going to take your vital signs, which includes your heart rate, your stir rate, your blood pressure, and yeah, our saturation levels too. I'm going to start off with your heart rate and your stir rate, and then I'll continue with the other ones after, okay? And I'll also do pulse ox. I'm going to leave this right here, okay? And can you get your competency measure? And then you want to check first the patient's pulse, because it'll be just like where the saturation will be together. It'll be together. That's how you know it works. And I'm going to take your heart rate.
Okay, very good. Perfect. Very good. Okay, so you have a 99% in your oxygen, so that's increasing, so that's good. Okay. And then your breath sounds this time around we're at 16 breaths per minute.
Okay.
Okay, and then your pulse this time around was at 78, so there's slight increase in everything, okay? So medication must be working. Okay. Very good. Okay. Now, are you feeling any dizziness or increased heart rate, anxiety, or, I mean, not anxiety, but jitters or anything?
A little bit, but
Okay.
not too bad.
And it's normal, okay? And so I do want to let you know that the reason that this medication was given to you is because in the very beginning when I mentioned to you that there was some wheezing, what that meant is that your the bronchioles, they're a little bit on the closed side, so it's a little bit tight, sealed. And so what this medication does is, since the bronchioles are a little bit constricted, the medication helped to open that up so that you could be able to breathe better. And I don't know if you can feel that difference already. Okay, perfect. So then I'm going to go ahead and do you think you could go ahead and provide another cough for me, please? Okay, so you could just cough right into that for me, please. A nice strong cough. Go ahead and breathe in. Very good. Perfect. Very good. That's a good one. Nice and clear. Okay. So now I'm going to go ahead and check your blood pressure again. Okay. Do you have any questions for me so far? No? Okay, thank you. I'm just going to ask again if you could go ahead and hold this for me, please. Thank you. Okay, so 120 over 82. Thank you. Okay, and then now I'm going to go ahead and if it's okay, I'm going to listen to your heart sounds again. Okay, if you could just turn to the side again for me, please. Thank you. And when I ask you to take a deep breath in, just take a deep breath in, okay? Okay, go ahead and take a deep breath in for me. Very good. And another one. Very good. Another one, please. Perfect. Okay. Very good. Another one. Are you feeling dizzy? No? Okay, thank you. Go ahead and go. Thank you. And again, I'm going to listen to the front. Is it okay if I answer that? Okay, thank you. Okay, excuse me. I'm just going to sneak in here. Okay, go ahead. Very good. No. Very good. Okay. Very good. We're almost done. Very good. And then I'm just going to listen to your neck again. Very good. Thank you. Let me go ahead and snap your pen. How are you feeling?
Good.
Okay. Are the jitters already starting to go away?
Yes.
Okay. Very good. Thank you. Okay. And then now I'm going to go ahead and perform once again this peak flow again. Okay, so we remember we want to make sure that we see a 20% increase. Very good. Remember to sit up. Thank you. And so remember, we want to reach our goal of 418. Okay. Do you remember how to do it?
Yes.
And I'm just still going to walk you through it. Okay. So if you could just breathe out and boom. Very good. Okay, very good. So right now you are at 375. So remember, it's going to be the best out of 3. Okay, so we want to try to get to our goal, and it's at 375 right now. Okay. Oops, I'm sorry. Okay, and boom. Very good. There we go. See, there we go. So now we're at 410. Okay. Now This is the last one. This is the good one. This is where you're going to get your goal, right?
Okay.
All right. Okay, you feeling okay? Very good. Bingo. There we go. I knew you could. You reached your goal. Very good. Are you feeling dizzy? Okay. Well, you did an excellent job on this. Okay. Perfect. So we reached 418. Okay. Perfect. Okay, Miss Adeno. It looks like we're pretty much done here. Now, you have you could just give us a call with using your call button in case you need any assistance. Do you need any water or anything right now?
No, I'm good.
You're okay?
Yeah.
Okay, perfect. Well, I hope you continue to feel better, and that way you can go ahead and go home soon. Okay?
Okay.
Thank you so much for everything. Okay, and again, my name is Mickey.
Okay. Thank you.
Thank you. Perfect. I'm just going to go ahead and walk out of the patient's chart. Going to go ahead and remove my gloves. Okay, and toss them. And then going to get 3 mLs of hand sanitizer. And again, 15 to 20 seconds or until it's completely dry. And so what I'm going to do now is I'm going to document. I'm going to document the peak flow results, all the vitals that I took, how the medication made her feel a little bit jittery after the medication was administered. And then that once I left her room, she felt better, so her jitters were already gone. So I'm going to document all that. Okay, so that is the proper way on how to administer and use a small volume nebulizer. Thank you for watching.